Hello, everyone. This is Bella Mehta reporting for Room Now from EULAR in Barcelona. I'll be sharing a very interesting development in the application of AI in rheumatological imaging, specifically in the early diagnosis of GCA or giant cell arteritis. So, as we know, giant cell arteritis is sometimes difficult to diagnose. Some symptoms may or may not present as they are in the textbooks. It affects medium to large arteries. And over the last few years, especially in Europe, I feel like there's a lot more uptake of ultrasound being used for diagnosis. And in the US, I don't see as much uptake because of many things, especially like availability, skill mainly, because accurate interpretation still requires a lot of training, and that we've seen over the years in a lot of studies. And such expertise isn't always available in all centers. We see some of it at least in big centers where there's ultrasounds, and ultrasound offers a great great way to diagnose this as compared to the traditional uh, biopsy, which is invasive. Sometimes we get like both sides biopsies just to make sure that we have enough tissue. So this to address this, what researchers uh, uh, in this particular uh, presentation talked about, and the presentation number is OP0343, is they developed this deep learning AI model, which is CLAUDICAITio. I hope I'm pronouncing it right. So this is short for classification of ultrasound data in arthritis by applications of artificial intelligence. So CLAUDICAITio, what does it do? It assists clinicians to classify ultrasound images and tells clinicians if this is GCA or not. But basically, they're using artificial intelligence to help this so that it can be assessed in any place, even in low resources or in settings where you don't have people who can read this. So, what the team did is train their models using 3,800 ultrasound images. So, lots of images from 2,240 patients or so. So, from multiple angles, from multiple sites, 38% of which of those patients had GCA related findings. And then the images were matched using ResNet 18 architecture. Again, ResNet 18, you'll hear it a lot in this deep learning world. But basically, it's a platform or an architecture on which some of these programs are built. Importantly, they incorporated artery specific information. For example, if the image was from the temporal artery versus the axillary artery. Thus, the model also learned what the differences usually between these two vessels are in terms of size or how they look. And then they tested three AI model configuration and found that one of the models performed the best, which is the artery fusion model. It's not about the details about the fusion model, but the fact that one particular model achieved an F1 score of 81% on AUROC of 0.94 or 0.87 in the temporal arteries. In axillary arteries, it was much higher, 0.94, which is very impressive given that, sometimes even trained eyes do not pick these subtle findings as much. Um, so, the model can at least accurately distinguish between something that is affected vessels and unaffected vessels. Um, it helps clinicians to even see the model tells where it is focusing, what is the uncertainty estimate, thus, giving the clinician tools to make decisions, not just tell you yes or no. It tells you why and how did it come up and where it's struggling. It's the same like when you call a radiologist and say like, hey, I think this is, but this is why I think it, the diagnosis is more likely or less likely. So these tools or the artificial intelligence tools are getting better to not only just say yes, no, and completely go wrong or right, but also give reasoning or show you why they're saying something. And this is probably one of the most advanced ultrasound classification for GCA worldwide, and I'm really quoting it from the abstract itself, that it's pretty robust data that went in. The outputs look pretty reliable, and they are going to expand the data set, validate it, get more data in it, and again more data as goes in the model, which makes it more powerful. But the ultimate goal is to have this web-based platform where anybody scans the patient, puts the images, and the model outputs what it's thinking, why it's GCA, or at least probability of why it's GCA or not. I think these are the tools. Again, even if they are not in clinical practice today, within the next 5 years, we'll see more and more of these tools coming in. So it's good to keep an eye, and it's refreshing to see how AI will transform our rheumatology practices over the next few years. And I'm always interested in this topic, so follow me for more updates. Bella_Mehta. That's on Twitter, and there's a lot more coverage out there on Room now. Thank you.